this computer here. So now hopefully the session is recording now. Okay. So as I say, now the session is being recorded, and we were going to be sharing on social media platforms like Facebook, Twitter, the Roscommon Leader Partnership website, and also for use in promotional materials, etc. And as per the GDPR guidelines from Roscommon Leader Partnership, as I just said there, anyone who doesn't consent to their image being shared, please keep your camera off during the event. If anybody has any questions as we go along, please use the chat function on the bottom of the page there. Linda Seiss, the project manager of SciCap, has agreed to look after the chat function for us. So we will do our best to answer any questions at the end, before the end of the event. And Linda's also going to look after us with the timekeeping, try to keep us all on track so we can get finished by 1:45, if not a little bit before. So again, I hope you enjoyed the event, and huge thanks to all the contributors who have agreed to come along and speak. And I'll pass you on to our first speaker, who is the Healthy Roscommon Coordinator, Sinead O'Brien. Say a few words.
Hello everyone, and you're very welcome. It's great to see so many who have joined today and to see the interest in the Roscommon Social Prescribing project. As Anthony mentioned, I'm the Healthy Roscommon Coordinator, so I work with both Roscommon County Council and Roscommon Children and Young Person Services Committee. They're the two local authorities in the county who receive Healthy Ireland funding under the Healthy Ireland framework. I'm sure you're very familiar with the Healthy Ireland framework, but I suppose essentially it's a framework for improved health and wellbeing across Ireland. It approaches health and wellbeing from a whole government and a whole society angle. So really we're looking at working from on the ground in communities the whole way up across government in order to deliver better health and wellbeing for the people of Ireland and of Roscommon as well. Healthy Ireland framework has been on the go for quite some time. The framework stems from 2013 all the way up to 2025, and just yesterday actually they launched phase 2 of the framework, and they released a brand new action plan for the years 2021 to 2025 to the end of the Healthy Ireland framework. I think it's very fitting that our Roscommon project is called the Well Connected project, seen as one of the, I suppose, main areas of focus for the next 4 years under Healthy Ireland is all about staying connected. Another huge aspect that's going to be focused on for Healthy Ireland is all about creating healthy places. It's going to be creating healthy cities, counties, schools, workplaces, and in particular that's going to be very relevant for us is a healthy community as well. Social prescribing will be a key element that will fit into the healthy community model that's going to be rolled out across the country. And I think we're ahead of the game here in Roscommon, given that we've already, I suppose, set up and established our Healthy Roscommon project. So it puts us in a really fantastic place to be able to lead out in health and wellbeing as the new strategic action under Healthy Ireland rolls for the next 4 years. I'd just like to say, I suppose, a huge thanks to Anthony, to Linda, and to all in Roscommon Leader Partnership who have done phenomenal work over the past year to establish this project and to get it to where it is today. Certainly Roscommon County Council, Roscommon LCDC are very proud to be involved and to be part of funding this project through the Healthy Ireland Fund, and it's something we'll be looking to support going forward, as I feel it's invaluable to our community in Roscommon. So just thanks so much for your work so far, guys. Well done, and thanks to everyone for joining today, because your continued support is what will help grow and build this project to reach as many people as we can across Roscommon going forward. Thanks.
Thank you, Sinead. I introduce our next speaker, who is the HSC Project Manager for Health and Wellbeing, CHO Area 2, Lawrence Gahan.
Hello, Anthony. Thank you, Anthony, and really delighted again to be part of this initiative. I think it's really wonderful to have so many people on this call, you know, and just to emphasize, I suppose, what Sinead was saying there, it's all about partnership working, and the development of social prescribing, I suppose, is relatively new in some ways in some parts of the country, but there are now perhaps over 20 social prescribing projects around the country, many of them either HSC funded or through the Healthy Ireland Fund that Sinead was referring to. And you know, some of the projects here, our first project here in Mayo goes back about 10 years, but now, as I say, there are many projects and all slightly different in different variations around the country, and some work, you know, in rural communities, some urban, and some working quite differently. But I think it's really important to create awareness, you know, around social prescribing, maybe take the mystery out of it and ensure that the people who most need it, of course, can get referrals to the project. And I think events like this, where people, you know, get to understand what social prescribing is about, and if we all perhaps can meet somebody in our daily life who could benefit from it. And I think it's really important for health professionals and people like that they will become more aware of social prescribing, but also anybody in community organizations and so on. And I realize the Roscommon project is only in its infancy, but I think it will become one of the best in the country and will probably go from strength to strength. So from that point of view, I think this is really important, and just want to thank Anthony and Linda again, and hopefully that we'll be able to grow this awareness now from here on, and that we'll have many more referrals and activity within the project. So thanks again, Anthony and Linda.
Thank you, Lawrence. I am just going to share a quick project overview. So I'm going to try and share that on the screen now. So PowerPoint slide, so hopefully everyone can see. And I'm going to try and keep this to 5 minutes max as well. So just a quick overview of the project. So yes, as you all know, it's called Roscommon Well Connected Social Prescribing Project, as Sinead mentioned there. And we've spoken about the funding and the management of the project as well. So yeah, there we go. Yeah. So yeah, in 2018, Linda and other interagency, I suppose, an interagency group set up the steering group to look for funding for the project. So thankfully that was achieved, and I began the role as coordinator in September of 2020. So the project basically is a free service open to anyone age 18 plus in County Roscommon who feels they need support to become more active and engaged within their community. And the whole idea is that engagement will help enhance health and well-being through improving opportunities for social connection and self-care. The work is really done on three core legs, really, I suppose. One-to-one support, helping people improve their local community connections, and giving opportunities to get involved in group activities. So what is social prescribing? As I said, it helps a person to improve links with local voluntary and community services and activities in their own area. So it allows GPs, healthcare professionals to offer social prescribing as a complement or to replace a medical prescription. But any agency can make a referral, obviously with the person's permission, or people can refer themselves into the project as well. And what we do is we work in partnership to develop an individual plan to help connect them to local activities and to achieve their goals. The referral process overall comes in 5 steps, and the first one is that referral. So it's a phone call or an email with a referral form, and that referral can be made by a community worker, agency staff, health professional, anybody at all really within the community, obviously with the consent of the person themselves, or people can refer in. What happens then is I arrange an informal meeting with them, and informal is the main word there, because it's a nice chat. It's a get to know you session. We complete an assessment of their skills, their interests, their hobbies, goals, and we'll have a chat about their present situation, what's going on for them, and what they would like to get involved in if they can. The next step then, I try and give them information on what's available locally. So I work on a thing called a community assets mapping exercise. And I can meet them multiple times to support them with confidence building, to help them try and figure out what their goals are, and to help them support them to take steps to change themselves. The person themselves chooses the activities and supports that they feel are right for them. And again, we continue to work in partnership to make a plan to support them to access those activities or services. So that could mean that I make a phone call, or that we share a Zoom call between myself, the referral, and the group, the activity person, to see if it's something they would like to do. And hopefully then I support them to actually access that group or their activity and follow up with them to see how they're getting on, and check in with them after a few weeks to see if it's the right kind of fit for them. Social prescribing is for anybody age 18 or over, as we said, and most people who would access the service would maybe have become socially isolated or socially anxious, especially in the last year. They could be new to a community, they haven't got their roots laid down in the community, they may be experiencing mental health difficulties, they maybe have long-term health conditions, could be living alone, could be somebody living with dementia or support somebody with dementia. Anything really. There could be a frequent attender at a GP or primary care services, and maybe just somebody's walking through stressful life events, bereavement, unemployment, retirement, illness, etc. They may be a member of a marginalised group, which is adding to a sense of isolation for them. The possible outcomes and the things that we would like to see achieved would be basically that first, the improvement in social networks and a reduction in social isolation, because that has been shown to contribute to an improvement in mental health and overall well-being. Hopefully it leads to a decrease in the need for GP visits, and it can contribute to lower stress and anxiety, and overall increasing your community connections and making new friends and maybe taking part in more exercise, outdoor activities, social groups, volunteering, etc. will help you improve the social capital overall. These are some of the examples of some of the things that people have been linked into so far. So walking groups that are hopefully ready to get up and running in the next coming weeks and months, sports partnership activities, National Learning Network courses, the Tidy Towns groups, who again are starting to meet now in outdoor settings, obviously socially distanced, but people are getting linked in with Tidy Towns groups, photography groups, volunteering opportunities, etc. It all depends on the person themselves and their hobbies, their likes, their things they would like to do. And we will hear a couple of examples of people who have gotten involved in volunteering opportunities as well in a few minutes' time. And yeah, the project contact details, as I said, just myself, the coordinator, so I can be contacted by phone call, 086 780 7820, or by email there, anthonyones@ridc.ie, where the referral forms are available, and request a very, very simple referral form. And at the minute, the project opening hours are Monday, Tuesday, Wednesday, 8:30 to 5:30, and 8:30 to 12:30 on a Friday. So I will stop the screen share there. Hopefully that's within the 5 minutes. And what we have next on the list is we're going to ask Dr. Brendan Crosby, who is a GP in the Castle Street Surgery in Roscommon, just to give us a few words about his experience with social prescribing and how it might help Roscommon.
Hi everyone, as Anthony said, Brendan's my name. I'm a GP here in Roscommon town. First of all, I really like to thank Anthony and the team for giving me the privilege of talking about social prescribing. I think as a GP and as GPs generally, we can be incredibly excited about it. It's going to prove, I've no doubt, a massive asset to general practice, but primary care in general. And I think it's a great attribution, or a great addition, I should say, to Roscommon. I'm very excited to get it underway. By way of a bit of a background, I do have some experience with social prescribing, having worked previously in Dublin. Indeed, my training scheme, Dr. Derek O'Ciarda would have been a massive proponent and essentially championed the addition of social prescribing to general practice going back some years now. So I would have had kind of first-hand experience exactly what social prescribing was, what the aims were, what the objectives were. In short, really what social prescribing is, the way I see it, is a massive complement to what we do in general practice. I think we can all, it's fair to say that we appreciate a massive proportion of our daily workload is, or at least has some elements that has a social component to it. With time, I think the social issues presenting to us is only increasing, and I think it's only going to increase further with the restrictions as they ease. We're already seeing it, a lot of the presentations during COVID, during restrictions, a lot of it is due to social isolation. I think that's something that's going to improve, or increase, I should say. As GPs, I think we're ideally kind of situated to identify social issues among our patients. The vast majority of times before a patient even sets foot in our room or a consultation room, we know a lot of the time what their social circumstances are, and indeed what social issues they may have. So we're ideally placed to identify them. The problem is, though, we don't always have the luxury of time to explore the exact means or the best means by which to, I suppose, resolve these social issues. And even if we did, like I said, it's trying to find the luxury of time to actually address them. But that's where social prescribing comes in. By way of an example, I suppose, from my own personal experience of social prescribing, how it helps in a very specific case. I first came across it, I first utilised it back when I was a final year reg working in Dublin. I was one of the wonderful jobs you get to do as a final year reg or any level of a reg is repeat prescriptions. And I came across a 76-year-old gentleman who was on a high dose antidepressant and a bit of quetiapine as well, a bit of a sedative.
You've just flicked onto mute there, Brendan. Yeah.
Am I back again?
Yes.
I'm back again. I'm not sure what I was saying, what part you got me there from, but I'll go back to the example I had. So just to reiterate, I was working in Dublin as a reg and I was doing repeat prescriptions when I came across a 76-year-old gentleman who was on quite high dose antidepressants and I decided he needed a review. He hadn't been seen for a while. And it was only when he was in, his story went back to 3 years prior. His depression developed 3 years prior when his wife unfortunately passed away. And before that, himself and his wife were essentially inseparable. They did everything together. They went for walks in the parks together every day. They had a bridge group that they attended playing cards 2 or 3 times a week. And they also went to the cinema. Unfortunately, his wife developed cancer, so he adopted the role of being primary carer. But unfortunately, when she passed away, all that dissolved, all that evaporated, and he was caught in a bit of a vacuum, socially speaking. His day-to-day literally got up, he'd go to the shop on his own, he'd bring his newspaper home, he'd read it, and for the rest of the day, pretty much potter about the house, watching a bit of telly without any social interaction. He first presented to the practice with and was diagnosed with grief reaction on account of his wife's passing, and he's referred to counselling. Counselling wasn't really for him, and then with further presentations to the practice, he was ultimately diagnosed with depression, started on medication to the point that he was on a large dose of antidepressants. But if you actually look at the details of the case, the problem is his social isolation. The problem was his social isolation. He wasn't leaving the house, he wasn't interacting with the community or otherwise, and essentially what happened was his social problems were medicalized to the point that he was put on fairly decent pharmacological therapy and without significant improvement. With a bit of convincing, we were able to get this gentleman to attend social prescribing. He didn't know what it was, he never heard of it, so it did take a bit of convincing. But within a month of attending social I'm very good at muting myself. My apologies. My wife would say I should do that more often. But anyway, a month after he attended the social prescribing, he linked in with the men's shed group as well as a gardening, and he was absolutely flying it. Within 6 months of it, he was down to 50 milligrams of sertraline, a quarter of the dose off his quetiapine, and he was absolutely flying. The issue was, and prior to him being referred to social prescribing, he's a gentleman that was born and raised in the area that I was practicing. He had no idea any of these services existed. Me being a culture from Roscommon up in Dublin, I certainly didn't know of any of these services. So without social prescribing, he wouldn't have linked in and he wouldn't have had that reintegration with society, with his local community. Again, I'm born and bred in Roscommon. I live in Roscommon now. I work in Roscommon. I wouldn't have a clue of a fraction of the service that are out there, if I'm being very honest. And furthermore, even if I did, I wouldn't have the luxury of time to go through each individual patient, what services are there, and indeed how they might be beneficial to them. But therein lies the benefits of social prescribing. We formalize the pathway, we get people involved, and like I said, the likes of Anthony doing great work, identifies what activities they might like to do, what might be a benefit to them, and therefore try and end the social isolation. Just to follow up on Anthony's slides, in terms of there's very good evidence coming from the UK where social prescribing has really taken off in the last decade or so, that it does absolutely reduce the number of presentations to general practice, a reduction in morbidity related to mental health and pharmacological prescribing related to mental health. So we know it's very effective. The last thing I want to say is I suppose the timing of this talk is incredibly appropriate. We all, to some greater or lesser extent, have experienced some degree of social isolation imposed by restrictions, whether it's not seeing friends or family or otherwise. So we not only can sympathize, but we can certainly empathize. And I think as restrictions ease, we're going to see more and more of these presentations where people have struggled with social isolation, and we're already seeing that now. So I really think the timing of the availability of social prescribing in Roscommon is absolutely ideal. I think, Anthony, you're going to be incredibly busy, and on a personal level, I am very, very excited by the service, and I wish you all the very, very best of luck with it. And I've no doubt it's going to be incredibly successful. And I encourage anyone in general practice to certainly look into it and consider it, because I think our patients will benefit massively from it. So that a bit of a spiel and a bit of inappropriate muting, I'll hand back to Anthony. Thank you very much.
Brendan, thanks a million. That was great. Yeah, that was brilliant there. We also, so now we have a couple of personal stories. So we've gotten consent from a few people who have linked into the project so far. So the first one, I'm going to hand you over to Felicia Lockery, who is the Community Development Worker with South Roscommon Family Resource Centre.
Hi Tony, thanks very much. I am speaking on behalf of a client that I've been working with for the last while. Her name is Caroline. She has a background of having mental ill health over the last 15 years. She has a diagnosis of borderline personality disorder, generalized anxiety and depression. Using Caroline's own words, anxiety makes me depressed and gives me suicidal thoughts and makes me self-harm. I heard about social prescribing through the South Roscommon F4C, the Family Resource Centre, and I said I would meet with Tony to see how he could support me or improve my life. Then the F4C here offered me a placement of 2 hours twice a week. So using Caroline's own words, I do different things like photocopying, scanning, putting activity and family packs together, tidying, basically anything that needs to be done. I feel relaxed and comfortable when I'm there. I feel like I'm serving a purpose. It takes my mind off my own life, my worries, as my mind is occupied. I feel very supported and understood. I enjoy the cup of coffee and the chat, and I feel welcomed by everybody there. So, and we wouldn't be without Caroline. She's a great asset to our team, and we love when she's coming in, and she's so eager and enthusiastic, and it is lovely. It's brilliant. So I wish Social Prescribing the best of luck and congratulations. This is great, Tony, and it's brilliant to spread the word about the programme. Well done.
Thank you, Felicia. That's great. Thanks a million. For the personal story there, I have a second personal story which I'm going to just screen share the words to here so I can read it. And this person, the name has been changed as well to ensure their anonymity. So I'll just read it out again. This is in this person's man's words himself. So my name is James. My family and I were victims of a crime in the UK some time ago, which totally devastated our lives. Our children were all doing well in school and uni, but as a result of what happened, we decided we could not live in the UK any longer and moved back home to Ireland to rebuild our lives and get support from family. However, even though I have been there for my family all my life, through terminal illnesses, alcoholism and breakups, when it came to my turn to look for support, it wasn't there and we were shut out. As a result, all of us suffered with depression and I had a breakdown. We had to look for help with strangers and thank God we got it. I was introduced to Sarah Brennan from South Roscommon Family Resource Centre, who was amazing and put me on various health and wellbeing workshops, where I met lots of people, young and old, all struggling with very similar mental health problems. However, the causes were all so different. Through Sarah, I met Anthony Owens, who introduced me to the Social Prescribing project to help me to find employment with a local community resource project. I had been running my own little business in the UK previously, but because of what happened, I completely lost my confidence and became withdrawn. However, through the kindness and professionalism of people like Anthony, Sarah, and my own GP, we got the help that we were so desperate for, and we were on the way to rebuilding our lives. My kids are doing amazing in school and uni here now, and we are starting to make friends and settle. I would say that it was the combination of the quick reaction from my GP in getting me the help I desperately needed, which involved medication and support from the mental health team and support from the social care side, i.e. Anthony, Sarah, Vita House and Jigsaw, that saved what was once a very strong family from breaking apart, and I am eternally grateful to all those people. I left Ireland when I was 16 due to growing up with a father that was an abusive alcoholic, which affected all my family and still does to this day. I am the only one in my family willing to talk about it and get help. Back then, there was little or no mental health support, and if you were struggling in school due to problems at home, you were labelled lazy, noisy or destructive and made to suffer more. However, I'm delighted to see that this is no longer the case now in Roscommon, and I would say the help is far superior than in the UK. After getting help from all the different support services, both medical and social, I can see the need for a scheme such as the Social Prescribing project, where everybody works under the same umbrella, so people get the support that they need from all combined elements working together. I am now a volunteer with the South Roscommon Family Resource Centre and liaise with Anthony on various issues. I will shortly be starting work in a local community resource project where I'm hoping that I can be there for other people to give them the advice and support that I got that might just save their family. Okay, so they are the they're the couple of examples of personal stories that we had. The next thing on the agenda is any questions and answers that we have. I'm not sure if there's anybody put any questions into the chat box, but if anybody has a question now.
Nothing in the chat, Tony.
Nothing in chat. Okay. Should we open the floor to anyone with any questions or comments or feedback? So to go ahead now. Yeah. Is that a no?
Everyone's camera shy.
Everyone's camera shy, yeah. Okay. Well, I suppose unless there is any more questions or any questions at all, let's say thanks to everyone again for all the contributors, the speakers. It's great to hear from the GP. Great to hear a couple of personal stories as well, and brilliant to get the input from Sinead and Eamon.
Well, do you want me to say a few words?
Yeah. We have the business. I'm just about to introduce you there.
Okay.
Eamon, sorry. We have the business manager from Galway and Roscommon Mental Health Services, Eamon Hannon, who has agreed to say a few words for us and maybe close out the event. So over to you, Eamon.
Okay, thank you, Anthony. I thought you were going to thank everybody and let us all off to lunch and out into the sun for a dose of vitamin D. I have a few remarks I just want to make. I was busy trying to make a few notes. I suppose the thing that struck me about social prescribing when I heard about it first was that it was a collaborative. And I think that's something that we do very well in Roscommon. When I look at all the little pictures on the screen, I see lots of faces I know from lots of things that I'm involved in as a HSE rep, whether it's people, colleagues really from the RIDC or from County Council. And I know there are some of my own HSE colleagues on the call as well. Social prescribing is definitely going to meet a need and bring lots of benefits to the people of Roscommon who engage with it. I want to echo the thanks from Anthony and everybody else, both to the contributors and to the people that organised this event today. Something that struck me a couple of days ago was that you probably have all heard the phrase that it takes a village to raise a child. Well, it takes a community to support and encourage and keep well everybody that is part of that community. And sometimes people lose that connection with the community. So our well-being and our connectedness is very important, particularly after the last 14 or 15 months. So this is an ideal opportunity and mechanism for people's connections for new connections to be made, and for linking people in with their local community. And what struck me was what Brendan said in terms of the example he gave. A man who lived the whole life in his community and he didn't know about a lot of things that were going on. There are lots of people in our communities in Roscommon who are the same way, and this really does offer us a chance to provide that extra support. I think the lived experience really brings home to us how powerful a tool this can be, how powerful a resource this is. And I suppose I just want to finish by asking everybody that's on to spread the message about this project, so that we can make sure that it continues long into the future, so that we can get word out to people. Undoubtedly, there are plenty of people who will benefit from the project, but we want to see it go from strength to strength. And finally, I just want to say thanks to Anthony for all of his hard work. and for all the legwork that went into making today work, particularly from a technology point of view. And we have had occasions, some of us on this call, when we have tried 3 or 4 different platforms and ended up using a telecall because it just sat one after another sat down. So it's great that the technology worked. So thanks. Back to you, Anthony.
Thank you, Eamon. And yeah, and I'll echo that as well. Thankfully, technology worked for us today. Hasn't always been the case. So yeah, listen, thanks everybody again. I know, let's say everyone is taking a bit of time out for their lunch. As Eamon said there, the sun is shining where I am, so we won't keep you any longer. But just give my thanks again to all my colleagues for all the help and the links, and to all the contributors as well. The referral forms are available from the email and from the phone call, as I said on the slides there. The event will be recorded, so if anybody would like to, I suppose, see it again, then please send us an email and we'll get it out to you. And yeah, and thanks everybody, and I wish you all a nice afternoon. And I think that's it here. We can close the event. So thank you.
Thanks very much, Tony.
Thank you all.
Tony, well done.
Thanks a million, guys.
Thanks.
Bye.
Bye.
Thanks, Million. Bye-bye.
Thanks so much.
Thank you.
I'll just remove a couple of.
I'll stop the record now anyway.